Joining us now is Dr. Robert Murphy. He's a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning.
Good morning.
What are your thoughts about the logistics that are broken here, and what part of that needs to be fixed, and how long will it take to fix it?
The delivery of the vaccines is very broken, but it is in the beginning process of getting fixed. Some of that's due to the governors of the states, but also now the feds are sort of getting their hands around it. First of all, they don't even know how many vaccines are in the stockpile. I mean, Rochelle Walensky, the head of the CDC, has stated virtually every day since she was appointed, she has no idea. So, they're going to get a handle on it. The companies are trying very hard, and they've upped their manufacturing as much as possible. And, this will have a positive outcome, but it's going to be several months before this gets fixed.
Someone forwarded me a story. It says the WHO says pregnant women shouldn't take the Moderna vaccine. Is that different information than they've had in the past, and is there truth to it?
Yeah, no, Robin, that is a very strange story. WHO comes up, they're a very thoughtful organization. They don't do anything just on a lark, believe me. They've got layers and layers of bureaucracy and global, participation. How they came up with that, they don't say why. It really is, it's kind of amazing. Pregnancy, of course, the main problem is, the pregnant women were not in any of these studies. They're excluded from the studies. But a few women got pregnant between dose 1 and dose 2. Nothing bad happened. Generally, pregnant women tolerate vaccines okay. All that is great. And they're trying to keep a handle on pregnant women that do take the vaccine. But it's a mystery. I mean, we really have to follow that closely. I don't know where that came from.
So do you advise pregnant women to get a vaccine in general?
Well, in general, it depends on the patient, and it depends what's happening. We're starting to get this infection under control here in Chicago. If a pregnant woman comes to her doctor, I'm not an obstetrician, I'm an infectious disease doctor, but I would get asked by an obstetrician, should I give this woman the vaccine? They don't do as well with COVID vaccine as non-pregnant women. And if they have any other medical problems, if they have diabetes or they have anything else going on with them, they definitely should strongly consider taking it.
Gotcha.
All right, Doctor, real quick before we get to viewer questions, where are we on safety of schools in general nationwide? What precautions are still needed, if any, before you would feel comfortable?
That's a big thing that happened yesterday with CDC. CDC came out and they've examined all the schools, particularly a group of schools in Wisconsin. And as has been said before, with data, they backed up the schools are not really the big source of outbreaks. Now, within us, that means that the school is taking appropriate precautions. One of the big culprits here is indoor sports. So indoor sports has to be watched very closely. And there was a recent indoor wrestling tournament, and 30% of the people that attended, and there were over 100 people that attended it, got COVID. So that kind of stuff has to really be basically curtailed, at least at the beginning of this opening up.
All right, some viewer questions now. This person says, we keep hearing about these variants, but I haven't heard if the symptoms present in the same way as the original virus. Can you clarify?
Yeah, good question, but easy answer. The symptoms are the same. You can't tell whether you have the variant or not. It behaves the same.
All right.
Next question. After a person is completely vaccinated, both doses, can they still be a carrier and pass it on to someone who is not vaccinated?
Very common question. The carrier thing has never been proven. However, remember, the vaccines are not 100%. None of them. 95% at best, and some of them a little bit less than that. Depends on your age group, etc. So a vaccinated person could get infected, and then they have the virus and they could spread it. That's different from a carrier, but a vaccinated person can spread the disease.
Okay. Next person says, oh, I am 13 years old, and I wonder, when will I get vaccinated? Oh, we're bringing in the kids now, Dr. Murphy. Look at you.
Hey, good. I'm not a pediatrician, but I know they eliminate kids from these studies. Now, one of the vaccine companies went down to age 16. Another one is going down to age 12. So, when that comes out, this 13-year-old could get vaccinated. They're slowly moving into the pediatric population. So it is happening, but it's going to be slow. Fortunately, children. And the reason why it's going slow is that kids, have such a mild disease, and very few of them get very sick. So that's the good side. So we have to be careful getting into children in these vaccines, but it's happening.
All right, Dr. Murphy, thanks for being with us. If you have a question for the doctor, we'll talk to him again tomorrow at this time. You can post your question on our Morning News Facebook page. Thanks, Doctor.
Thanks, Doctor.
Have a good day.
Hey, Paul.